And the whole goal of periotherapy, or gum disease therapy, is to get the tissues to reattach to the tooth so you won't have pockets. It does this, I call it kind of a Velcro-like closure. It does this with what we call fibroblasts. And the more fibroblasts you have, the more likely you're going to have tissue reattachment. So with all the healing and the fact that it really stimulates fibroblasts, you're going to have a much better attachment. So I've had very, very deep pockets reattach when I use ozone.
Is there anything in your bag of tricks that you can use for gum recession?
Gum recession is a tough one.
You think I'm going to give you easy ones?
You don't really get gum tissue back.
Okay.
That's unfortunate.
Yeah, that's what I thought. Potentially stem cells seems to be the only thing that I've encountered.
Stay tuned. That doesn't mean I know everything anyway. So that's great. On the subject of clenching, which most of us do, I'm going to take a sharp right-hand turn here.
Sure.
First of all, clenching is a sleep disorder. That's something that most of us don't realize. Apnea is a hugely undiagnosed problem that people have, and if any of your listeners don't know what apnea is, I know you've had guests talk about it, but it's where the tongue falls in the airway and chokes you off so that you don't breathe for 10 seconds at a time. And it's, well, let's just talk about me, for instance. I have this forward head posture. I have a very small lower jaw, and even 6 months after I wrote my chapter on airways, I didn't realize I had apnea. I don't have any of the typical
risk factors. Yeah.
I don't have the 16 to 17 inch neck. I don't have the gut. I'm a fairly small person. I knew I gritted my teeth, but gritting, by the way, kind of helps strengthen all these muscles and keeps your chin from falling back on the airway, so it does help to keep you alive, but it's not the best way to approach apnea. Because I do have apnea, which I finally realized, I have a 26% greater chance of dying than somebody without it. That's opposed to someone who has...
This is at night when you're sleeping?
Yeah, well, just because of what it does. I could
okay.
Yeah, it can be at any time because of the whole... I'm fighting to stay alive every night, basically. Now, even if I were to answer all the questions on the Epworth Sleepiness Scale, I would come up with a 0 on that. So most people have no clue that they have it. And dentists and hygienists are absolutely perfectly placed to diagnose it. And I think it's really important that they do.
So, and the major risk factors, if a hygienist or dentist sees a person who's has the clenching of the teeth?
That's one clue. Scalloping of the tongue, TMJ problems back here, and there's something called the Melon potty index, where you just, when you're doing the oral cancer exam and you look down their throat, not when they're saying ah, to see what percentage of the throat you can see. And I have images on my website to show how much that should be. It should be wide open, and most of us don't have that. And I'm going to peel back one layer of the onion and say that when you see this, I mean, dentists treat it with jaw forward positioners at night, and that's wonderful. But, and of course there's the dreaded CPAP that people use. But if you take it back to their swallowing patterns, quite often if you teach a person to chew, swallow, and breathe correctly and get all these, repattern all these muscles in a therapy called myofunctional therapy, you will certainly lessen their apnea, and in some cases, it takes it all the way away. So myofunctional therapy is something I wish that more dentists and hygienists were aware of. It will be happening. There are 26 graduate courses in Brazil. It's huge in Brazil, where they've done all the work. And it's about to happen here because so many of our children are mouth breathers. They don't have a lip seal. They develop, as a result of it, too small of a jaw. Their dimension from here to here is long. Their dimension from here to here is short. When you have myofunctional therapy, in almost all cases, the TMJ is much more comfortable. A lot of these people get out of pain. It's going to be used in prior to orthodontic therapy and during orthodontic therapy, because, again, if you repattern these muscles and have them work the way they should, and very few Americans really do that, me included, the teeth will come in straight, the whole face will form completely differently. Your child will look better.
And apnea will tend to disappear.
It can, you know, again, myofunctional therapists work in collaboration for the most part with other, but certainly everything improves. It's like the rest of the body. This has to be exercised.
Well, what are your thoughts on the use of dental appliances that are specifically manufactured for individuals to compensate for some of the structural deformities to address apnea? Because I know that's a common.
Yeah, the jaw forward positioners.
Yeah.
Almost always the teeth are going to shift because you're bracing against the top teeth. So a person has to know that that's going to happen. And incidentally, one of the first patients that I was talking to about sleep apnea had actually been, I mean, I was embarrassed to say, had been on a CPAP for 4 years. And I was like, oh, do you know that you probably have this? So a lot of times people get fitted with their CPAP, but they don't necessarily get titrated to make sure that they're working properly. Because it turned out that when I sent her to a dental physician to maybe make a jaw forward positioner because she didn't like her CPAP, her blood oxygenation went from 67% to 98% in 3 days. So she was carrying a lot more oxygen in her blood just because she was really getting her tongue off her airway.
Oh, this is with the appliance.
Yes, I'm sorry, she had an appliance made. So her CPAP really, even though it was blowing oxygen at her, she wasn't picking it up, I think because her tongue was so...
It was obstruction.
Obstructing her airway. And side benefit was she dropped 40 pounds because when you have apnea, your hunger hormones are messed up, and she didn't even realize that that could happen.
Yeah,
but,
it messes up the adrenals, the cortisol levels.
Yes,
it's
it
a
does.
whole panoply of dysfunctions that result.
So,
but this myofunctional therapy is also something that could be useful. If someone was interested in it, how would they find out more about that?
I'll be making a much larger part of my website having to do with that because I think it's probably even more critical than anything we've talked about today. I just finished a postgraduate course in it, and it's really sad to see all the people who have gone through orthodontics 3 times, had orthognathic surgery where they tried to move the jaws around surgically, still have pain, still not function. You know, nobody has addressed the muscle imbalances that cause them to need orthodontics in the first place or to need the orthognathic surgery in the first place. So,
but myofunctional therapy tends to do that.
It does. And again, there are not a lot of therapists out there yet. But
mostly in Brazil, unless you live in Brazil.
In Brazil, by the way, where the women are beautiful, they use a lot of these simply from an aesthetic point of view.
My personal dentist is a Brazilian. So.
Oh, nice, nice. Well, it leads them to have prettier lip lines, you know, it's all nice. So, again, I think that's something that you want to watch your children for. If they're mouth breathing, you need to get them to someone who can help them with those habits. So.
Terrific. So any other tips that you'd like to share or closing comments?
No, I think we pretty much covered some of the
Terrific.
hot spots.
Really thank you for all you've done and all you've been able to contribute, and really opening our eyes at these really marvelous tools and resources and approaches that can really impact our dental health, because if our mouth isn't healthy, it's really hard to be healthy overall. And it's really an enormously important part of the whole equation.
It is.
And I really appreciate the tools you've been able to offer us to help take control of our health.
The solutions are out there. That's the wonderful part.
Okay.
You know, we know the problems, but the solutions are pretty exciting.
All right. Well, thank you.
Thank you.